Aloha, everyone, and welcome. Thank you for joining us this evening for Palolo Chinese Homes Family Council and Community Sessions meeting. My name is Amrik Sidhu, or you can call me Rick, as I've come to be known as affectionately as Rehab Rick. I'm a physical therapist by background, and I also am the Clinical Operations Area Director for Genesis Rehab, which partners with Palolo Chinese Home. I'm delighted to be the moderator this evening for what will be undoubtedly a very interesting and educational hour as we delve into the art and the science of rehab and rehab world. Oftentimes when we think of rehab, we know about physical therapy, but oftentimes don't know exactly what is included and what all that physical therapy encompasses, as well as the other equally important disciplines, occupational therapy, otherwise known as OT, and speech therapy, as it's commonly referred to. It's actually speech language pathology. And we wanted to take this opportunity to share more about what those three disciplines are, what we do, what we offer at Palolo Chinese Home through our various rehab services. So for this important and informed discussion, we've brought together a few of our star therapists who are each physical therapy, occupational therapy, and speech therapy. So we have with us Mary Irvin, who's a speech language pathologist. She's also our director of rehab at Palolo Chinese Home. She's been with us in Hawaii now for 2 years, but she's been a speech therapist for much longer than that, and brings with her many years of leadership experience as well. Also, we have Elizabeth Fitzpatrick, also known as Queenie. She's our occupational therapist, also at Palolo Chinese Home. She's been with us for 4 years here in Hawaii. We also have Coco Seguccio, who's a physical therapist, and she's been in Hawaii since 2009, working as a physical therapist. So you'll be hearing more from the three of them just shortly. We also have with us Darren Yoshimoto, who's Palolo Chinese Home administrator, for a few remarks. So thank you all for joining us. So first, before we get into our presentation portion of tonight, I wanted to share a virtual housekeeping to help our attendees get the most out of this session. So at the end, after our presenters, we'll open it up for Q&A. There's a section on Zoom labeled as Q&A near the bottom of your screen if you move your mouse. You could submit the questions that you have during the session by typing them into the QA box. We might not be able to get to every question during this session, but we'll make a note of them and work to get them answered soon after in a follow-up email. We'll also be recording today's Zoom session and sharing it with our attendees, with all of you, so that you can review any information again. And also, please note, our speakers will be the only ones who are visible during the presentation, so we won't be able to see you. Okay, so to start us off, we have Coco, again, who's our wonderful physical therapist, who will then be followed by Elizabeth, and our rehab director, Mary, will be our third presenter. So Coco, if you want to go ahead, I think we're all set.
Yes, I think I'm gonna give me a moment to share my screen because I have a little presentation. Okay. Okay. All right, here we go. Are you able to see my screen?
Yes.
Okay. All right. So again, good evening, everyone. My name is Coco. I'm a physical therapist working at Palolo Chinese Home. And thanks again for giving us this opportunity to show you what physical therapy has to offer. So I just briefly want to start by discussing what is physical therapy and what do physical therapists do. So in a nutshell, physical therapists are movement specialists trained in evaluating and correcting movement to improve function and quality of life. In our evaluations, we strive to ask our patients what their personal goals are so that we can help them attain those goals, because we strive to provide patient-centered care all the time. There are so many things that physical therapists can do, but for our purposes today, because of the limited time, I will only discuss 3 major points, which are therapeutic exercises, gait training, and our fall prevention initiative, which is called the Balance in Action program. Okay, so the first one is therapeutic exercises. Therapeutic exercises is a wide range of exercises or activities that are aimed to restore, maintain current function or improve function. But most of these exercises can actually be grouped into 4 categories. So the first one is, of course, strengthening exercises, which are exercises that use resistance, such as weights or cables or therabands, in order to improve muscle strength. And then, of course, we have endurance exercises that are exercises performed over a period of time to increase like cardiopulmonary health for those with heart and lung problems or deconditioning, and improve activity tolerance. The second one is flexibility exercises, which are your stretching exercises and your range of motion exercises to improve movement and alleviate muscle tightness. And lastly, balance and coordination exercises, which are designed to improve motor control and reduce falls. So on my next slides, I just wanted to show you some of the things that we have in the gym. So the first picture is like a balance foam or balance disc. So we usually have our patients stand on it so we can challenge their balance. The next one is just our weight rack. So on the top, you see that there are bands, and then ankle weights, dumbbells on the side, and the weighted bars. The next picture is a floor bike. And then the next one, these are just some of our bicycles or lower extremity ergometers that we use to improve strength and endurance or activity tolerance. So yeah, that's just some of the equipment that we have. And then the next thing that I wanted to highlight is gait training. So what is gait training? Gait training is another physical therapy specialty where we teach our patients how to walk again after sustaining an injury. So usually we do this by training them with assistive devices. So I'm pretty sure you guys are familiar with walkers, canes, rollators, but we also use other specialty devices such as the parallel bars and the Evo Walker, which I'm going to show you later. Training surfaces is also a very important part of gait training. So we usually start our patients on even surfaces, walking on even surfaces, and then we progress them to uneven surfaces, especially if we want to reintegrate them in the community. And here at Palolo, we are so privileged to perform exercises and gait training outdoors, despite pandemic restrictions. Just because the way the facility is laid out, we are able to safely take them out, get some fresh air, do some exercises while we try to rehabilitate them. So here we can see the things that we use for gait training. The very first picture is what we call the parallel bars, very sturdy piece of equipment. So we usually bring our patients there to begin so they can hold on a very stable surface when they start ambulating. Of course, the walkers, and then the hemi walkers and rollators. This next one is called an Evo Walker. So it's something that we use for very low level patients because it can literally support your upper body. So that will make standing and walking easier. So that those are very helpful equipment. And then of course we have the stairs for stair straightening. And then here, I just took some pictures of the outside, but I'm sorry, these pictures don't even do justice of the beautiful panoramic views that we have in the facility. But usually we can bring them here, do our exercises, do some walking. That little striped path is actually a decline and incline ramp that we can train patients in. So it's been very refreshing to be able to do that at Palolo. Okay, and then lastly, I would just wanted to briefly talk about balance in action. So It is a known fact that falls is a very big problem. I mean, a whopping 50% of people aged 80 years old fall each year, and that's a huge number. So that's why my employer, Genesis Rehab Services, developed this Balance in Action program. So what it is it's an evidence-based care model that is designed to standardize the practice from screening to assessment to management of those falls to ultimately reduce falls in our facilities. So yeah, so it's very important to know that this is a multidisciplinary model. So the patient, their families, doctors, nursing, rehab, activities, social worker, everybody plays a role. But of course, because I'm a PT, I'm only going to talk about the PT role in this care model. So first we start with the screening, which is we have to determine is there a risk for falls, and I'm going to tell you almost all of our patients do have a risk for falls. So these are all the risk factors that we look at during our evaluations. And then once we determine there is a risk for falls, then we can conduct a very thorough fall risk assessment. So these are all the things that can be looked at in the fall risk assessment. But of course, the PT's main focus is the functional mobility assessment. So that is where we learn or where we evaluate how people get out of bed, or how do they stand up, how they transfer, how they walk, how they do steps, and also assess their balance. And then so of course, what do we do after we find out that people have these problems? We have to manage it, right? So the PT's role in management are the following. So of course, we look at how they're walking, their mobility, and their balance, and we try to improve their strength, especially in their lower extremities. And then something that Genesis Rehab uniquely offers also, it's what's called the Otago exercise program. So the Otago exercise program is developed by the New Zealand Falls Prevention Research Group. So it's evidence-based, meaning that it's been through a lot of research and it's been proven to improve balance, strength, fitness, and general well-being. It's a series of 17 basic muscle strengthening and balance exercise that are progressed gradually over time. And we usually can prescribe this as a therapeutic exercise and then eventually be given as a home exercise program. And it can also be a foundation for a restorative nursing program for our long-term care patients, so we can maintain their function. So this is kind of like the manual that we have, a little booklet that we can give to our patients and their caregivers. And inside there's the pictures and the instructions and even a track sheet of how often, how many exercises to do in a day and how to progress it so they can check their progress. So yeah, very simple, very basic, but very helpful evidence-based tool that we can offer our patients to help reduce falls. Okay, so that is it. And there you go. Thanks for your time. And I hope you learned something from that brief presentation. Thank you.
Thank you, Coco. That was great. Elizabeth, you want to tell us more about occupational therapy?
Yes, I do. Hello. First of all, I just wanted to say thank you for the opportunity to allow us to share what we do and why we do it and how we value your kahuna. And I also want to say that I absolutely love what I do because occupational therapy is such a unique and complex practice. Many people aren't sure exactly what occupational therapy is and usually associate it with a job or career, when in fact, occupational therapy is the only profession that helps people across the lifespan to do the things that they want and need to do through the therapeutic use of daily activities, in which we define as occupations, hence occupational therapy. Occupational therapy practitioners enable people of all ages to live life to its fullest by helping them promote health and prevent or live better with injury, illness, or disability. Occupational therapy practitioners have a holistic perspective in which the focus is on adapting the environment and or task to fit the person. And the person is an integral part of the therapy team. In essence, while other health practitioners may focus, excuse me, while other may focus on specific injury or illness or diagnoses to guide the healing process, the occupational therapist considers the whole person. Our profession is rooted in understanding the patient's prior living environment, prior level of function, and most importantly, what occupations are important to them. Once we understand what motivates our patients, we find creative and scientific ways to help them achieve their goals. While occupational therapy has many populations that they provide services to, the important population in this case is our kapuna here at Palolo Chinese Home. Here at Palolo Chinese Home, we work with the elderly patients to help them regain their independence in whatever occupations or tasks that are important to them and their family members, whether it be basic activities of daily living, which is what we call ADLs, which includes toileting, bathing, dressing, etc., or continence training. So if your loved one is all of a sudden incontinent and you're not understand why, we can help with that. We can work with that. And then there's also instrumental activities of daily living, which include meal prep, laundry, light household cleaning, and things like that. So we do this through creative, client-centered interventions, along with use of adaptive equipment, such as reachers, sock aids, bottom buddies, and then adaptive equipment like Coco was talking about, such as walkers and canes. We also do this through the use of strengthening, range of motion, balance, and endurance. So again, we pretty much cover the whole person. The beauty of occupational therapy, especially in this setting, is that we're able to really understand our patients' and families' needs and goals by listening and communicating with both patient and family. We use that information to creatively and uniquely reach our patient goals. We also overlap with physical therapy and speech therapy as an intercollaborative team to do everything we can to meet those goals. Here at Palolo, the team also consists of the administrator, the nursing staff, the social worker, the dietary team, and we are all interrelated and collaborating on a daily basis to meet the unique needs and desires of our patients. In summary, occupational therapy is a client-centered health profession concerned with promoting health and well-being through occupation. We're focused on addressing the whole person rather than one specific illness or injury. The primary goal of occupational therapy is to enable people to participate in the activities of everyday life through meaningful tasks. Whether this means taking our patients outside, like Coco was talking about earlier, versus indoors, or providing a listening ear to know exactly what is meaningful. We also, we achieve this outcome by working with people and communities to enhance their ability to engage in the occupations they want to, need to, or are expected to do, or by modifying the occupational environment to better support their occupational engagement. And sometimes it's not always as easy as saying, hey, let's go to the toilet, because for some people that's not really important, especially if they have caregivers doing it for them. But what we do is, like I said, we find creative ways to make it interesting and say, well, hey, if your goal is to do something else that requires you to take your hands off the walker and have balance, well, how can you do that if while you're using the toilet, you can't take your hands off the walker to pull up your pants? So we really get in there with everything we can. We look at the whole person and we work with the collaborative team to do everything we can to get those goals met, whether it be the patient goals or the family goals.
Thanks so much, Elizabeth. That was great.
Thank you.
Mary? Mary, you want to share some speech language pathology? It's a whole lot more than speech, as you're about to learn.
Yes, definitely. I know that when I go into a patient's room to introduce myself as their speech therapist, I hear all the time, why do I need speech therapy? I can talk just fine. And they have a fair point. Our name doesn't give us nearly enough credit for everything that we do. It's kind of a joke in the world of SLPs. People call us speech therapists because you can't fit speech, language, cognitive, swallowing, pragmatics, modalities therapist on a name badge. So we got really abbreviated, but there's a lot that we do. And I just want to highlight a few of the things that we do. One of the biggest areas that we address in a skilled nursing facility is dysphagia, which is the medical term for a swallowing problem. After a lot of different medical diagnoses, stroke, Parkinson's, just general weakness, you can end up with some problems with your swallowing because that is based on muscles. You know, there are a lot of muscles involved in swallowing. It seems like such a simple thing because we all do it so automatically, but actually there are many different muscles involved, and there are also like lots of very small, simple thing, or not simple, very small movements that happen in quick succession that it really does leave a lot of room for things to go wrong. So when we're working with someone with a swallowing problem, we're looking for signs or symptoms of things going the wrong way towards their airway instead of towards their stomach. So when that's happening, things that we're going to notice are things like coughing a lot while you're eating, or clearing your throat a lot, or hearing your voice tone change to sounding gurgly or wet, like there's something sitting on top of your vocal cords. That's all a sign for us that things aren't going the way that we need them to, and that we really need to step in and do something to make their swallow safer so that they don't end up with pneumonia or some other infection from things getting into their lungs. So the different ways that we can work on a swallow are diet modification, which means either thickening liquids to make them move more slowly, giving your body more time for all of those quick actions that happen in succession to actually happen in the order that they need to, so that things are going to go the right way. Or changing the consistency of a solid so that it's already partially processed if it's a problem at the level of somebody's mouth, so that we can make that swallowing even safer while we work on strengthening it. So to strengthen it, another thing that we're working on is exercise. You know, just they're not big muscles like your legs or your arms when you're working with PT and OT, but there are a lot of muscles in our neck, in our tongues, in our lips that all facilitate a safe swallow. So we're working on exercises to do that. And then at the same time, we could be also incorporating what we call vital stim therapy, which is a neuromuscular electrical stimulation. With all of our muscles, the way that they engage is by electrical current from our brain telling us that they need to contract. So we kind of sidestep our brain and directly can stimulate those muscles to really accelerate and enhance that basically strength training program of doing exercise for our swallow. Other things that we work on are teaching strategies to make sure that you're eating more safely by going slowly, taking small bites or small sips, just to do anything we can to make that process of eating more safe while we're strengthening those muscles to have a safe and efficient swallow where we can get back to those normal foods and drinks that people want to be eating regularly. And then the next big area that speech therapy works on is cognition in a skilled nursing facility. So that's things like attention, memory, problem solving, and safety awareness. Those are all really important things for getting someone back to their independence. So, and these are a really great area where we can collaborate with other disciplines, PT and OT especially, to really reinforce the messages that they're giving, especially like safety recommendations and things like that. If somebody has trouble with their memory and they're having to use a new device or having to remember new precautions to make sure that they're not putting weight through their leg after having a surgery, or not bending or lifting or twisting when they've had a spinal surgery, those kinds of things. We can really help reinforce those messages with our memory training. Our memory, as well as all of our cognitive function, are really like a mental muscle. They definitely, statement, use it or lose it, really applies to your memory, just like it applies to any active muscles. So you really need to be doing things like engaging in conversation, reading, working on puzzles, and then also doing some strategies to keep your memory strong so that it can really keep you independent at home. So we really focus on those puzzles, those exercises to challenge our brains, but also on strategies and memory aids so that when they're not working ideally, we can get around them a little bit. And memory aids especially are really helpful for that, because those are things that you as a family can set up and put into place for a loved one to keep them independent as long as possible. So things like using a pill box and maybe going over to their home and setting that up on a weekly basis for them so that they can be safely managing their medications without having to go through every pill bottle and read the label, remember their dose, things like that. Also using a calendar to keep track of doctor's appointments or social engagements. And technology now is more and more becoming such a huge asset for memory. Things like your cell phone that has a calendar built into it, a place where you can do notes and reminders, storing telephone numbers. You can set alarms for your loved one in advance so that they have an alarm reminder to take their pills at breakfast, at lunch, and at dinner. Things like that that you can really help to establish as routines for them so that they can stay independent as long as possible. And that can be done either by the family or by the speech therapist in the facility when we talk to the patient and their family and find out what their goals are and what we need them to be able to do when they get back home to living independently. I know we're running kind of short on time. So the other areas that speech therapy can work on are our speech itself. Sometimes, especially after things like a stroke or with Parkinson's, our ability to communicate can really be put in jeopardy. And it's not that you don't have anything to say, you just aren't able to access that language or get things out clearly. So there are exercises that we can work on and strategies that we can work on for our speech and language as well, that are really important for ensuring communication, which is so important to people, and also independence for as long as possible. So yeah, thanks.
Thanks so much, Mary. That was awesome. And mahalo to all of our presenters. You all did a fantastic job. I think that we all can see very clearly that there's a whole lot more that goes into rehab than just PT and OT and speech. You know, you could hear all three presenters really putting the patient first, right? And focusing on function so that our loved ones can remain safe and independent for as long as possible and live the highest quality of life. And that's different for each individual. And so that's really what our passion is and what we do. So I hope you were able to see that. You know, it's definitely valuable in that our kapuna and their loved ones have a clear understanding of what rehab has to offer and how we achieve those goals. So I hope we have a deeper awareness about what rehab means to us all. I know everyone's looking for an overview of what programs are offered at Palolo Chinese Home. Genesis is proud to partner with Palolo Chinese Home to offer the most comprehensive menu of services statewide. Darren can help walk us through what that means for our kapuna and our families. Darren?
All right, good evening, everyone. Yes, thank you, Elizabeth, Coco, Mary, for sharing much more detail of what you guys all do day in and day out. And like Amrik just said, a robust therapy program, which is what Palolo Chinese Home is focused on, and this partnership with Genesis. It's a lot more than I think what a lot of us understand. And so, taking the time tonight to really dive into some of the expertise that is brought through each discipline and how through a collaborative effort, we really are able to meet the needs of all of our residents and the variety of conditions, medical diagnoses, acute illnesses that we face. And our goal, like Enrique said, is to be able to do that on an individual basis and get people better, back to baseline, get them home, back to their prior living environment, and enjoy the quality of life that we would want for any of our loved ones. And, with that being said, another important piece to this rehab project is, or program, is that that we want to share is a lot of people understand the skilled rehab. Something happens, an acute illness, you go to the hospital, they recommend you to go to, or your loved one to go to a skilled nursing facility with the goal of going through a rehabilitative program and the nursing services and to go home. And that's ultimately what we would want, is people to return back to their community or their prior living environment, as we call it, to live their lives. But the other important thing to know with a robust therapy program, and it's Palolo's focus to continue to maintain and improve the lives of all of our residents, even those, and Elizabeth touched based on it, those that live with us, the long-term care residents, is that these services are also available to all of our residents who enjoy the programs at Palolo Chinese Home. And without getting too technical with the insurance pieces, but those are things that we can do, is look at benefits and benefit packages and see how we can enroll people into therapy. So, and it's not just for our long-term care residents. These are things that we're always looking at for all of our residents who live in our adult residential care home. If they've had changes in condition, or maybe they had a fall, or we're noticing weakness, then rehab referrals are something that we look at. The other program that benefits from this is through our senior daycare program, and that's an option for residents and clients who will join our senior daycare. And if we notice that there are changes going on, or things that maybe we can help work on, then we can also look at how can we refer them to our rehab program here and help these individuals also. So it's a coordination of care. It's the continuation of what we look for here at Palolo Chinese Home as an organization across all of our programs. And it really lives up to the tagline of, better care, better lives. And having a robust therapy program provided in partnership with Genesis Rehab Services is, what we strive to do day in and day out. So I really thank all of you for sharing a little bit more detail. And I hope this was helpful for all of you attending tonight, to have a clear understanding of everything that goes into our commitment to better the lives of our kapuna. So with that being said, I did want to add, because I have a lot of family members here also, just to note on a side note that, through COVID, it's been a challenge as far as visitations and seeing your loved ones. And as we learn more about vaccine and the vaccine programs and new recommendations and guidance is coming out, I just want to remind everybody that we are following that here at Palolo Chinese Home, and we continue to open up our home and open up visitations. There are ways that we can open up indoor visitations as well, not just for comfort, end of life. And so please contact us to schedule visits, and we are doing everything we can at this point to accommodate visitations for all of our residents. With that being said, Enrique, again, thank you to you and your team, Genesis Rehab Services, and I turn it back to you for any question and answers.
Mahalo, Darren. So to follow, we have some helpful contact information if you have any questions after tonight's presentation as well, so that you can be sure that you can access and get some more information on all the services offered at Palolo Chinese Home. So as mentioned, we have recorded today's Zoom session, and we'll be sharing it with all of you so that you can have that contact information handy, along with all the highlights from the presentation, and that will be sent out in a follow-up email. So let's open up to our Q&A session. I see we have a couple of questions already. So again, while we might not be able to get to everything, we will be sure that we follow up as needed with any questions that may not get answered within the time constraints. So let's take a look at some of our questions here. The first is, how can I get some more information on the New Zealand model of physical therapy? So that sounds like it's in reference to Coco's presentation on balance and action and the Otago exercises. Mary, do you want to address that?
Sure. Well, I mean, balance and action is something that we do in our department with the guests. As Darren mentioned, those might be people that are with us for short-term rehab, or it could be people coming from our long-term care or our care home or from the adult daycare. But it is a program that was developed or that was further developed by Genesis for that balance and action program. But if you were interested in that specific research study, I think we could probably find a way to get that posted or sent out with maybe some of the resources after this program.
Mary, can they access, because I know that the exercise booklets and there's some information in there are available on Rehab Central through SmartWorks. Will they have access to Rehab Central?
We have access to Rehab Central, and I order those programs. We have about 50 in the gym right now, and then as we get down to the last few, then we can always order more so that we're always able to provide those with patients as they're leaving as a continued home exercise program.
And maybe this is a question we can also follow up on with the email and provide a little bit additional information on the Otago exercises. So thank you. Next, we have kind of a three-part question. Maybe Coco, you might want to take the first one here. What is a great exercise to help seniors keep their balance?
Balance is very multifaceted, but a lot of the balance programs really focus on lower extremity strengthening. And the best way to improve balance is to challenge balance. So, varying base of support, or some people even talk about Tai Chi. There's no really solid one size fits all, like I said, because everything's gonna kind of be unique on the individual, what their deficits are. So so I guess if after evaluation, then we can find out those deficits and very specifically work on those deficits. So like I said, leg strengthening exercises, stretching if there's tightness, and of course varying like surfaces and balance schematics maybe is the best way to do it. So all those combined, I think, would be best programs.
Sure. Maybe you can help with this one also, Coco. Does therapy help with pain, especially back pain?
Oh, yes, very much so. So there's a lot of things that you could do. There's pain modalities, there's heat, there's ultrasound, there's cold modalities, and we do have those in the clinic. It all depends on the acuteness of the problem. Of course, stretching and movement exercises, because motion is lotion. So if you're not moving and you're not doing exercises, then it tends to increase pain. So yes, I would say 100%.
Awesome, thank you. We have two questions that are kind of similar. So Mary, I'm gonna send these your way, but I'll read them both so that they both get addressed. The first is, does the nursing staff carry over the therapy lessons taught in treatment? And the sort of similar question is, are the nurses and CNAs at Palolo trained or able to apply these approaches and strategies of PT, OT, and ST in their care of residents on a daily basis?
Sure. So yes, in answer to that, the nursing aides and the nurses themselves all do receive a lot of training prior to graduation from their programs, as well as when they're hired into the facility. And then if there is something very unique to a specific person, specific strategies or specific exercises that wouldn't necessarily be common knowledge, then our team makes sure that the staff that are working with that patient regularly do also have all the information that they need to carry over exercises with the restorative nursing program or safe swallowing strategies if they're going to be helping one of the patients with their eating in the dining room, things like that. So absolutely, we do train the staff if there are things that need to be done in addition to the training that they receive when they come into the facility.
Great. So if somebody's on therapy services, PT, OT, or speech, and those services are coming to an end, there's a mechanism to transfer that care to the nursing staff then?
Yes, we have a wonderful restorative nursing aide who actually does work very closely with the physical therapy and occupational therapy team as well, so that if somebody is coming off of that skilled stay, but they're going to be staying on a more long-term basis at Palolo, either in the long-term care or the Arch, then Verna, the restorative nursing aide, would work closely in those last 1 to 2 sessions with the therapist, primarily working with the patient during their stay, to make sure that they have a exercise program that'll carry them forward and maintain that function that they were able to achieve while they were working with us skilled.
Awesome, thank you.
Mm-hmm.
We have a follow-up question for Coco here related to balance. It says, does core exercises help balance? And core is all capitalized, so I'm not sure if that's a specific set of exercises or if we're just talking about our trunk, but you can help us answer that one.
Yeah, I think I'm not sure if about the other core, the capitalized one, but definitely if it's your core muscles, they do play an integral part in your balance, because if you have a weak core, then your other balance structures in your body have to work harder and maybe overstrain them or overstress them, and that is your central part of your body. So having a strong core definitely is helpful in improving balance.
Great, thank you. Maybe Elizabeth, you can help us with this one. Are there exercises taught to help with incontinence? I think maybe you're muted. There you go.
Yes, there are. There are not only exercises, but there are toileting schedules and programs. We have basically like forms you can fill out to track your toileting and how much you're producing and how much you're not. But basically, when someone is experiencing like new incontinence, we like to put them on an incontinence toileting program where they're basically getting to the toilet every hour, every 2 hours, to try to train their brain with their body to get it to where they're both on track. So they're learning, their body is learning how to void regularly without having accidents. Also, there's the Kegel exercise. There are pelvic floor exercises that can be done to help facilitate stronger bladder and to help with incontinence. So yes, and that's where the incontinence program comes in. And if there is a patient who is struggling with that, we have a few forms and different exercises and toileting programs that we can put them on to help with that, definitely.
Great, thanks so much. I believe that's all of our questions for tonight. So we're starting to wrap up our time for today, but I really wanted to extend all of our gratitude to all of you for joining us and your continued support of Palolo Chinese Home. And for the Palolo Chinese Home families, we look forward to seeing you at Mother's Day drive-in visit and sending you all the warmest aloha until we meet again. Thanks so much. Aloha.